Welcome back to Western New York Living. As the COVID-19 vaccination becomes more readily available here in Western New York, some in our population have questions about minor side effects the vaccine may cause. For women watching right now, you may have heard stories about the vaccine impacting the images doctors receive during annual breast screening exams. We took that question to Dr. Scott Rudzinski at Windsong Radiology. His answers and recommendations will help ease the minds of anyone who may be putting off their yearly exam.
This past year has certainly been stressful on most people. Keeping up with regular doctor visits and regular exams like breast cancer screenings has been difficult for some. At Windsong Radiology Group, they want all women aged 40 and over to understand the importance of yearly exams. They also want to reassure all of their patients that they're taking the proper steps to keep them safe during their visit and make them aware of a small side effect that the COVID-19 vaccination may cause to their lymph nodes.
Part of the natural response to getting a vaccine is your body mounts a reaction to it, and that's why we have immunity towards the disease. So basically what can happen is your lymph nodes, which is part of the natural response, can enlarge and look big. Just like when you're sick, you can feel lymph nodes in your neck. Same thing in your armpit. It's reacting and your body's making the right cells to fight off COVID. So they are in overdrive and they're working hard, so they get bigger. And so when we take a mammogram, your armpit, some of your armpit is included in those pictures. So we see some of those lymph nodes in basically the edge of the picture. And so sometimes we can see these lymph nodes be enlarged. And we're trying to decide if that's for benign or what we call reactive causes, like from a vaccine, or if it's something more suspicious. So what we've found is that it's actually a small percentage that we actually see that have this show up on pictures. So while it's something that can be seen in about 1 out of every 10 people might get some soreness or some enlarged lymph nodes that they feel or the doctor might feel, by the time they get pictures or what we're able to include on pictures is actually a very small amount of people.
Since the enlargement of lymph nodes is only temporary in a small portion of women who've received the COVID-19 vaccination, Dr. Rudzinski and the rest of the staff is recommending patients follow a few suggestions set forth by the Society of Breast Imaging.
If you're going in for a screening, you can get your test, your screening mammogram done before you get your vaccine or 4 to 6 weeks after your vaccine. That could decrease the chance of having a lymph node being enlarged. And then, like I mentioned earlier, that chance is very small. So even if you're unable to reschedule something, just come in and get your exam. And if there's something abnormal, we'll work it up and talk to you about it. Chance is very small. We will ask about vaccination status when we're taking on part of the intake form, so that when we're looking at your images, if say a node looks a little bit enlarged, we know that that can be due to the vaccine, and we're less worried that it could be due to something that's actually more suspicious.
Dr. Rudzinski understands that some women still may be hesitant to take part in their yearly screening, whether they're reluctant because of safety concerns or waiting for the COVID-19 vaccination. He mentioned a few subtle symptoms women should be aware of that would definitely warrant an immediate exam or discussion with your doctor.
Everyone is different. Your tissue is different. And so just becoming familiar with what your body feels like. And so if something feels out of normal to you, the most common thing that we see is either pain or lump. Those are the things that we see a lot. Unfortunately, pain is very common, but good news is not really related with a high specificity for detecting cancer in that area. So it's more common just to be from a benign cause. Lump is something else. If you feel a tender and firm spot, that's something we definitely want to get checked out. And other things are discharge, dimpling or changes of your skin. Those are the main things that we're evaluating and can be linked or associated with cancer. However, if you're having an issue like a lump or a follow-up of something that we've seen before, discharge, pain, that's something that we don't want you to wait for. So we want you to come in, even if you just had your vaccine a couple of days ago, and then say you feel a lump, just come in, we'll work it up, we'll know your history, and we'll be able to integrate that into what we see on the pictures.
At Windsong Radiology, patients truly come first. If you have any questions about breast imaging or any of the service they provide, you can head over to their website at windsongwny.com. If you'd like to set up an appointment, simply give them a call at 631-2500, or you can easily do it on their website as well. Their main offices are located at Spindrift Drive in Williamsville. Now, coming up next, if your drafty windows or doors need replacing, Ivy Lee Construction can help. They'll be joining us to discuss the latest trends and features in windows and doors when we continue.
This segment of Western New York Living was sponsored by the following: